Coming up, we'll be on location at Washington Psychological Wellness in Gaithersburg, Maryland, discussing the benefits of holistic psychotherapy and how it can help us overcome mental health issues and challenges that so many people deal with, along with improving your overall wellness and achieving a happy and fulfilled life with one of this region's top clinical psychologists, Dr. Leda Kaveh. Welcome, Dr. Kaveh. It is a pleasure having you on our program today.
Thank you so much for having me and for shedding light on something so important, such as mental health.
Absolutely. We want to celebrate mental health awareness with all that people are dealing with the pandemic. And we're very much looking forward to having you on to educate the community. And with that being said, I wanted to ask you, if I may, Dr. Kaveh, if you could please begin by telling us what holistic psychotherapy is and how it is different than, say, the more common traditional approach.
Absolutely. So holistic psychotherapy actually isn't a very new concept. It actually dates back to up to 2,500 years ago during the time of Hippocrates, with the premise being that we aren't just focusing on one aspect of an individual. Instead, we are focusing on establishing an equilibrium or balance within the individual, viewing the individual as a whole made up of separate parts that work in conjunction or unison with one another. And so when we discuss holistic psychotherapy in comparison to more traditional approaches to therapy, as holistic psychotherapists, we're really focusing on not just the symptom, but as the individual as a whole, whether that mean by mind, body, or spirituality.
So you really want to, as you just said, Dr. Kaveh, find out what the root cause of the problem is, as opposed to the traditional, typical Band-Aid approach.
100%.
And what are some of the patient benefits from this approach?
Well, I think the benefits are numerous. First and foremost, this type of therapy, it works. And not only are we looking, again, at the individual as a person, but we're integrating many different aspects of the individual, whether that be culture, background, spirituality, and you name it. Holistic psychotherapy can be used to treat anything from anxiety, depression, low self-esteem, to more severe pathologies, such as PTSD, psychosis, or suicidal ideation. Now, the premise is basically just that. We look at the individual as a human and not just a symptom.
Yes, indeed. And as we touched on in the beginning of this interview, certainly with the pandemic, COVID-19, the Delta variant, and all that people have been dealing with worldwide, it has certainly heightened issues that many of us already had within us, right? And added some more, unfortunately. And with that being said, I wanted to ask you, what would you say are some of the most common mental health issues that you're seeing in this current environment?
So the pandemic has certainly heightened our need for mental health services and advocacy in the community, with the chronic stress and absence of control amongst millions of individuals. It's created the perfect storm for a global mental health epidemic. Some are even calling it a second pandemic. And so we're seeing a lot of anxiety, depression, suicidal ideation, insomnia, and even post-traumatic stress disorder as a result of the scary times of the pandemic.
Yes, indeed. And what would you say, Dr. Kaveh, can cause these conditions to occur, or heighten them, if I may say?
This is a global trauma that we are all experiencing, and I want to emphasize that it's completely normal and okay to feel anxious and stressed during such unprecedented, abnormal times. But that being said, when we are in trauma mode, what our bodies do biologically to try to protect us is that our sympathetic nervous system kicks in and gets into what we call the fight, flight, or flight mode. And so when that happens, it initially is helpful for acute emergencies, but if it lasts 6 months, years, as a lot of us are experiencing right now with the pandemic, that's when our nervous system goes into overdrive. And that's when we see increases in stress hormones such as cortisol and adrenaline. And that's when we start seeing, problems. Paradoxically, instead of helping us, we get more medical complaints and ailments. That's when we start mental health issues showing up, as well as physical symptoms. It's also very hard to escape the pandemic right now. You turn on the news, it's on. You go on social media, it's on.
There's one trigger after the other, right?
Exactly.
Every time we turn it on or we come across folks, I mean, since that has been impacting society in such a horrific and tragic manner that you can't avoid it, literally.
Exactly. And naturally, sometimes as humans, what we do when we're feeling anxious is we try to control the situation by over-researching, over-watching, over-learning. But this, again, can have a paradoxical, twist to it and cause us more harm than good.
That's right.
And so having that balance and keeping the balance of knowing information but knowing when to take a break, I think, is important. And on top of that, I think just the changes that the pandemic has brought about. People are losing jobs. There's economic turmoil. A lot of adolescents and teens are losing important milestones, whether it be graduation, in person, or having a homecoming dance.
So it's a lot.
It is a lot.
Some very good points indeed, Dr. Kaveh. And I wanted to also ask you, what is the evaluation process for diagnosing a patient-specific condition or conditions?
Well, first, before I talk about diagnosis, I again want to really emphasize that it's normal to be stressed out during a pandemic. And it's important that we have grace and self-compassion and not be hard on ourselves if we're feeling anxious. That being said, if you find that your symptoms are really interfering with your ability to function on a daily, then I think that's a good time to seek professional mental health help and evaluation. And so diagnoses can be simply done by setting an appointment up with a mental health professional and kind of going through the intake process. And if you want a more formal assessment or kind of report done, then you could really seek psychological assessment and testing services.
Okay. Is there a type of person that, would you say, Dr. Kaveh, is more susceptible to developing some or a number of these mental health issues that you've talked about briefly?
Yeah, so mental health does not discriminate. It affects everyone, despite ethnicity, background, socioeconomic status. But that being said, mental health has been impacting different groups differently, especially during this pandemic. Women and young adults have seemed to be the most impacted by the pandemic, sharing that they are the most stressed and distraught mentally because of this. In fact, 70% of 18 to 29-year-olds have reported feeling that this has significantly impacted their ability to function. And this could be for numerous reasons, whether it be the social isolation, uncertainty of the future, or just missing important milestones. In terms of occupation, there are a lot of occupational hazards and stress occurring in those who are first responders and those who are essential employees, healthcare providers. We're seeing a lot of burnout. We're seeing a lot of secondary trauma and a lot of compassion fatigue. And so that's really been taking its toll on that population. And minority populations are also seeing a discrepancy in terms of the impact that it's been having on them.
What would you say, with all that being said, are some of the most effective strategies or tools in your toolbox that, as far as therapies go, that are available to help folks address some of these issues, Dr. Kaveh?
Of course. And so as holistic therapists, we really value self-care and taking care of yourself, not just within treatment, but also on your own, out when you're at home, at work. And so I think first and foremost, it's important to, again, have compassion for yourself. Don't be so harsh on yourself. This is not a normal experience we're going through. And so, of course, we're going to have anxieties. It's so easy for us to jump to the I shoulds. I should be a better parent. I should be less stressed from the pandemic. I should be able to have better work-life balance. And don't get me wrong, we all have these, what we call cognitive distortions or unhelpful thinking patterns at times. But again, we need to take a step back and show ourselves loving kindness.
Yes.
And take care of all aspects of yourself. Take care of your mind. Why not treat therapy the same way we treat going to our our primary care doctor for a physical? Put in the same effort you put in your mental health for your physical health.
That's right. It's very important. That is a great point and a great analogy. You're absolutely right. We all go for our annual checkups, right? Or physicals. And we know the importance of going to a primary care doctor. Well, that's on the physical side. But what about the mental side, right? And that is so vital. You're absolutely right. And what kind of results can be expected from some of these therapies that are utilized to help folks deal with so many issues?
I think the results can be profound. I think that people will find that they are living more authentically and intentionally a life that they want to live for themselves.
Yeah.
And those who come in with specific goals that they want to overcome, then those can really be tailored and targeted through therapy and seen trickled out in different areas of one's life.
How many sessions would you say typically would be necessary to effectively resolve the issues that so many people are dealing with when they come to you, for example, as a patient? And I want to put in the proper disclaimer. I know that depends on each patient, each person. Everyone's different. In fact, no two people are alike, even though they may have similar symptoms. Everyone's different. We're all wired in a unique way, right? So what would you say to that?
So you already said my first half of the spiel of you're all different, so it really does depend on who's sitting in front of you and what the goals are. Some concerns such as anxiety and depression can be treated in as little as 6 to 8 sessions, whereas other more severe situations or concerns could take years or even a lifetime. And one of the benefits of holistic psychotherapy is that you don't necessarily need to be diagnosed with something or be demonstrating symptoms to benefit from this type of therapy. And so a lot of people, as with any other wellness routine, whether it be eating, healthy, exercising, kind of take on a lifetime approach to integrating holistic psychotherapy into their daily.
Yes, indeed. And are the results permanent?
The results can be permanent, but that being said, it's an ongoing process, and our mental health is always evolving, and we need to be intentional in ensuring that we're taking care of ourselves.
Yes.
And so going back to the seeing a doctor for a physical examination, sometimes we need checkups and check-ins to make sure that our ducks in a row and we are really fulfilling a life that is authentic and in line with our values.
As far as the risk of regression, what would you say about that?
A phrase I sometimes like to use is sometimes life gets in the way of life, and we can have the most peaceful inner balance and equilibrium, but we can't predict the future, and sometimes circumstances, as we can see with the pandemic, get in the way. And so there's always some risk of regression with anything, especially with mental health treatment and care. But that being said, I can't emphasize the importance of self-care and just showing up for yourself and continuously putting yourself in mental health first.
Yes, indeed. And what are some of the other therapies that you offer here at your practice, Washington Psychological Wellness?
Well, because holistic psychotherapy is an umbrella term for integrative therapy or whole person-based therapy, we do provide numerous different therapeutic modalities and treatment options, whether it be cognitive behavioral-based therapy, psychodynamic-based therapy, dialectical behavior therapy, and we also do different modalities in regards to individual therapy, family therapy, couples counseling, play therapy, you name it. And I think that what we really are working on is just getting to know the person and not taking a quote-unquote cookie-cutter approach to care and really tailoring treatment to the unique needs of the individual.
Of course. Very well said. Obviously, you customized the various treatment plans accordingly to help each of your patients achieve their goals.
Exactly.
And as far as your practice, I understand you offer both in-person visits with patients, but also telehealth sessions, depending on what is more convenient for your patients.
Absolutely. We utilize a HIPAA-compliant EHR system that really makes it convenient for clients to be wherever they are and feel comfortable enough just to get on their tablet, phone, or computer in the privacy of their own homes and get the treatment that they need. And so it's been very helpful in general, but especially during the pandemic when keeping safety in line is an important thing.
Now, we're literally out of time, Dr. Kaveh, but I wanted to ask you, before I let you go, you and your practice, Washington Psychological Wellness, here in Gaithersburg, Maryland, have certainly established a reputation for excellence, not only as a leading clinical psychologist in this region, but also for your patient-centric approach in helping your patients. And you helped a lot of folks, and counting, I might add. I just wanted to ask you if you can please tell us what you feel really helps separate you and your practice apart from many of the others.
Thank you for that. I think what sets us apart is our team of highly dedicated, skilled, and passionate clinicians who really put their heart and soul into bettering the mental health of our community. And we really value a community approach to care. And so we're proponents of consulting with individuals or healthcare providers in the community, whether that be psychiatrists, medical doctors, clergymen, teachers. We find that that's important to make sure that we get the integrative, wholesome care. We're also a very diverse bunch. We come from very different ethnic, religious, cultural backgrounds. And as a team, we actually speak a total of 5 different languages. And so we take multicultural competency and inclusivity very seriously and are respectful of all individuals, regardless of age, background, gender, sexuality, and so on. And finally, we have a fantastic client care coordinator who really goes above and beyond to ensure that every client is matched with the right fit therapist for them. Again, we don't just kind of have a blank way of doing things, a cookie cutter way. We want to make sure it's a good match. So we're really just looking at the person for who they are.
And on that note, I'd like to thank you again, Dr. Kaveh, for enlightening us, educating us, and being a guest on our program during these very trying times for so many folks. I know you're going to help a number of them. Thanks again for being a guest.
Thank you so much for having me.